Hello, everyone. I'm Dr. Rohan Khandelwal, your Marrow SS General Surgery faculty. And it's my great pleasure to introduce Dr. Shaurya to all of you. She secured rank 1 in the recently conducted INISS exam in the surgical gastroenterology division. And I'm more happy conducting this interview because she is an undergraduate from VMMC, which is where I graduated from. So, heartiest congratulations, Dr. Shaurya.
Thank you, sir.
So we were chit-chatting before the interview, and she's still doing her residency from PGI. She's still a final year at PGI. So amazing result, first attempt, probably the most competitive super specialty branch. How does it feel like?
It feels great, sir. I'm happy.
Great. I'm sure you must be happy. So as soon as you finish your residency, you'll start your MCH now. So Dr. Shaurya, when did you actually start thinking about surgical gastroenterology, and how did you go about your preparation?
Sir, about surgical gastroenterology, sir, uh, my exposure to surgical gastro started very early, sir, because our wards and our residency in general is more oriented towards surgical gastro. So, and in my third semester, which was my ward residency, I was posted under a unit which was doing a lot of surgical gastroenterology related cases. So I got really oriented there, sir. So that is where my interest in surgical gastro started.
So most of your preparation probably happened in the wards and by the cases that you were seeing in the clinics and the wards. In
Yes.
addition to that, what were the resources which you used, the books which you read? Because surgical gastro is a branch where, usually when I talk to students, they say that there is a lag of at least a year to 2 years before they get into an MCH. So it's a really demanding branch and very difficult to crack the exam. So what are the other resources which you utilize?
Sir, starting with textbooks, sir. Sir,
Hmm.
I have read Bailey and I have read Sabiston, sir. These were the
Hmm.
two primary textbooks. Some topics I have read from Shackelford, like post-gastrectomy syndromes and all. They are given matlab, very, very well in Shackelford. Uh, and for some topics, I have also referred to Bloomberg, sir.
Hmm.
Then other topics which are very important for clinics, very important for emergencies, and in general, like biliary injuries and all. So for these things, miscellaneous things like I had to prepare a presentation in my GE rounds on
Hmm.
uh, post-lap chole biliary injury. So I read. So then for these topics, I refer to other papers and other things. Like there is a very good book by VK Kapoor sir on biliary injuries. So that is for miscellaneous things. For like EHPPO, there are very good articles by Sarin sir. So for other topics, I have read some other uh, resources, but mostly I think Sabiston is a very, very, very good book. I really like Sabiston, sir. It is very good for final year MS exams also because everything is given very appropriately. मतलब इतना डिटेल में भी नहीं है और इतना ऐसे shallow भी नहीं है. Even things like overall it is given very well. And but for like breast I read Bailey में breast
Hmm.
बहुत अच्छा है sir. Uh, और so mostly it was from Bailey and Sabiston.
Perfect. And with regards to preparing questions for surgical gastroenterology, right? Students are very keen to crack the exam. So where do they prepare questions from? And did you get a chance to use the Marrow Q Bank as well?
Uh, so QBank I did not use, but I have gone through a majority of surgical gastro videos from
Hmm.
Marrow. They are
Okay.
very good videos, very very good. Especially colon rectum, definitely very good videos. Esophagus, very very good, and hepatobiliary also, which covers like all the three topics. But all videos are very good. And
Hmm.
also some topics in surgical onco I also watched. uh, I think thyroid I watched. uh, Thyroid from general surgery part, your videos I have also seen, but that was for my final year preparation, sir. Sir, but also the question paper was very like one cannot go into a black hole of surgical gastro preparation only for this kind of exam, because around 20 to 30 questions, sir, were not surgical gastro. Because they were asking very detailed things about, for example, breast reconstruction. Like there was one question ki, if you're reconstructing breast, the nipple areola complex, the size, matlab, width and height of the nipple that you will create. These are very detailed questions not pertaining to surgical gastro. There were questions on trauma like GCSP. I think soft tissue sarcoma also one question they asked. So these things. And then intraop images they asked heavily. Esophagus and
So
also.
what exactly were they asking in the intraop images? Anything which you can throw insights on for future batches?
Esophagus intraop images, matlab thoracoscopic phase ka they asked sir ki I think recurrent laryngeal nerve wala lymph node they were trying to ask, although I am not sure, but mostly. And other CT images they asked ki hemangioma वगैरह, मतलब CTs one should try to read. So
So post the MCQ exam, what were they asking in the interview in the surgical gastroenterology portion? Were there clinical scenarios, any particular topics which students should prepare for the future?
Yes, sir. In the interview part, so it is 80 marks for theory, 20 marks for interview. In 20 marks, they have divided into two sections. One is 10 marks spotters. So spotters were very difficult. वो उसमें भी sir there were intraop images only and other radiology, and in this and the other 10 marks is for case scenarios. So they asked three case scenarios. I think one was dysphagia, one was post lap biliary injury, and one was upper GI bleed. So these three case scenarios, they did not ask, like before going into interview, I asked a lot of people. So they said ki they will ask first, they will ask about general things, ki paper kitna likha hai, or and other things.
Right.
But ki tell me about yourself. All that, matlab, my interview at least it started directly ki dysphagia, post lap biliary injury, directly, and all that.
Okay.
Spotters also, matlab, directly 10
So
spotters.
another question. So somebody who's interested in preparing for surgical gastro, you of course had tremendous exposure in surgical gastro in PGI, but somebody who's probably not had so much of exposure, because if you talk about general residencies, it'll be, lap choles, it'll be perforations, obstruction, bit of onco, bile duct injuries, a little bit of that, but not such extensive exposure. So if somebody doing it from what the routine is, how much time will they require to prepare for surgical gastroenterology for the INISS exam?
Sir, I think it depends on person to person, but definitely they should try to get exposed first.
Right.
Maybe join a department somewhere, because one has to be really into it to actually pursue it. That is my opinion of it. But definitely try getting exposed first.
So I agree. I mean,
And then
something as specialized as this, if you get exposure, it also becomes easier for you to understand what you're reading. Otherwise, sometimes when you just read books, it all seems like Greek and Latin initially, if you haven't seen it actually happening.
But once they have decided that they want to prepare, so I think 6 months to 1 year is a fair enough time.
So, Dr. Shaurya, thank you very much for discussing all this with us. I think so for you, it's been an amazing journey. You're about to finish your residency and you've matched into an MCH program. And thank you for sharing insights for future batches as well regarding how they can approach a surgical gastroenterology residency. Before we end, any final tips which you would like to share with the future aspirants?
हो जाएगा थोड़ा सा चिल करो नहीं मतलब try to have clarity if you want it or not. Once you have that clarity, just go after it. Try to study, try to be in the ward, try to appreciate what is happening around you and
Yeah, I think
listen
so.
to your
That is very
seniors.
important. Yeah. Yeah. So I think so. The bottom line, what I can take away from here is get exposure. And if you get exposure in that branch, then what you're reading will also make sense. So that is the key takeaway which I could gather after talking to you for since the last few minutes. So thank you very much for taking out time. It's been an absolute pleasure, and it's so nice to see VMMCNs doing so well.
Thank you,
Congratulations.
sir. Thank you, sir.
All right. Take care. Take care of yourself. Thank
Thank
you.
you.